Joseph Kadri. On today's edition of the program, our discussion will be on one of the organs of the body that is responsible for your ability to identify an object, describe an object, talk about an object. Here we're talking about the eye. As important as the eye is, a lot of persons don't really know. But if you want to find out how important your eyes are, why don't you blindfold yourself for, say, 30 seconds? And then you can talk about how important, of course, your eyes are. And so that's our major eye disease that is responsible for blindness. Many people also don't know about it. And this disease has no signs and symptoms. You can't trace a cause to it. Talking about glaucoma is responsible for blindness. Is, if not the first, but is among the top causes of blindness, in Africa. Including those that are from the black race. What can be done to prevent glaucoma? What measures can be taken to ensure that it is detected early? All of these will be coming through the eyes of the essay to the registrar of optometrists and dispensing optician registration board of Nigeria, Dr. Chinaka Umusu. Very good morning and welcome.
Good morning. Thank you very much. Thanks for having me here.
You're welcome.
Thank you.
So quickly, tell us about glaucoma.
Okay. Glaucoma is one of the leading causes of blindness in the world. In fact, it's the second leading cause of blindness after cataract. Usually we describe it as a group of eye diseases which affects the optic nerve, head, and eventually results to blindness. And if you look at the terminology or the description, group of eye disease, what it simply means is that glaucoma most times does not exist on its own as a single entity or causative factor in that process. So what it means that there are myriads of other factors, that predisposes glaucoma to come into place. So that is in a nutshell, to describe or define or explain what glaucoma is all about.
Yeah, can we talk about the risk factors? What are they?
Okay, there are several risk factors, which is not limited, but you have the following as age. Age is an important risk factor in glaucoma. In as much as glaucoma can occur within any age bracket, but predominantly from age 40 and above, you are already at risk. I get to me. And also lifestyle habits as well can also be a causative factor to glaucoma. We also look at diseases as well. There are systemic diseases that can actually result to glaucoma. For instance, high blood pressure, diabetes. These are systemic diseases that are also causative factors to glaucoma. Drugs as well. The kind of drugs we make use of or take systemically can predispose one to having glaucoma. So these are some of the risk factors. Even trauma to the eye can actually cause glaucoma or lead to the process of glaucoma developing in one's eye and all that. So these are some of the risk factors to glaucoma.
Yeah, what about race?
Yes, race is also an important risk factor. Predominantly blacks.
Why is it so?
Possibly because of our pigmentation, definition of our body physiology. Are you getting me? As regards to race, and also look at our tropical weather here as well, which also can contribute to that effect. So, but research and survey has always made it known that blacks are more predominant to having glaucoma than any other, race out there.
Yeah, but let me also seek for clarification on this race. blacks in Africa or blacks everywhere?
Well, blacks in Africa and also blacks everywhere. Predominantly, yes, blacks in Africa and also blacks everywhere. So is already an established research survey that is already a working, document out there. Exactly.
So sad.
So sad. So what it means is that being black already, you are at risk of having glaucoma. Exactly. Yeah.
So what about family history?
Family history, yes. When we talk about family history, we're looking at the genealogy. Are you getting me? The composition and makeup of the family lineage and all that. Glaucoma is a hereditary condition also, just as you have high blood pressure as a hereditary condition and also diabetes as a hereditary condition. You find in the family where maybe a grandparent is having glaucoma, it could skip a certain first generation, possibly in the next generation. You see one or two, individuals in that family also having glaucoma, and also possibly another set of offspring, as the case might be. So it falls in line with that. So if in a family a parent is diagnosed of glaucoma, we always advise that the children and the grandchildren, as the case might be, always make it a routine habit to check their eyes at least once every year or once every 6 months in order to monitor their vision, to have early catch or traces of glaucomatous features, such that treatment can start on time and all that. So it's a hereditary thing. It runs in family.
It runs in the blood.
Yes, it runs in blood. It's genetically disposed as well. Exactly. So that is it on that aspect. So is an important pointer for us to always consider in the aspect of causes, are you getting me, or risk factors to glaucoma. So that's it.
For those that are sickle cell,
yeah,
we know science has evolved and it can be changed to AA, with a stem cell transplant.
Transplants, exactly.
Is there anything like that for glaucoma?
Okay, at the moment, sadly, there is nothing like that as regards to glaucoma. And that is why up until now, we will always say that glaucoma is not a curable eye condition or eye disease. Is only an eye condition and eye disease that you can manage over time. There are situations that surgical intervention can come into play. That is in some cases whereby the topical medications or drug being administered are not working, or the patient is not responding well enough to them. Then surgery can also be recommended, but also with very careful disposition on that, considering the age of the patient that is involved as well. But even at that, funny enough, after surgery, it still doesn't mean that you're going to totally abstain from using your topical medications for the glaucoma check, and all that. You still continue with it. So it's a condition that you manage all through life. As the case might be, you manage it all through life.
Once
diagnosed, you manage it all through life, and just like you're having high blood pressure and diabetes as well. So, and also managing it all through life, you can have very good results also if you have a timely diagnosis, patient compliance, and the right or adequate treatment modality is in place. You lead a normal life. Exactly.
Interesting.
Yes.
Let me bring you back to drugs. You say it can also lead to glaucoma.
Yes, exactly.
Yeah, so I want to ask, is it when people self-medicate, or someone is placed on medication?
Exactly. Both. The truth about it is both. Both in terms of self-medication and also in terms of certain prescriptions, prescribed for a patient to take. And that is why is always important, or we always look at the aspect of history of a patient. Are you getting me? Prior to prescribing some certain medication, in the course of taking your case history as the case might be, and all that. Certain drugs, like for instance steroids are high risk factor drugs for glaucoma. Now you get me. So most times we are mindful of how you administer steroids to a patient and all that. It's just like as steroids is contraindicated in high blood pressure situations and all that. So these are the kind of medications that can actually predispose one to having glaucoma. So in quotes, always mindful in administering steroids. So for someone who is doing self-medication and is going over the counter to buy medications that contain steroid and all that, of course you are putting yourself at risk. So you always advise get your prescriptions from the right source and all that. Exactly.
Let's look at prevention. What is the best method of preventing glaucoma?
Okay. Glaucoma prevention is very important. For instance, what we're doing this week, which is the World Glaucoma Week precisely, is also a way of creating awareness and sensitization as regards to this scourge. It's a global scourge, one of the leading causes of blindness. We're trying to tell people this is what is in place. This is what we can do. Talking about prevention, one, we need to look at lifestyle habits. What are those things we engage in that can actually cause glaucoma? And it cuts across from both physical to what we congest, and also the aspect of being knowledgeable, meaning that we need to go for periodic eye examinations. Coming to prevention, I told you that trauma can cause glaucoma. If you have an altercation with someone, and maybe as a result of anger, you raise your hand, there is a punch or blow, or there is a slap, as little as slap and all that, that act can actually affect the anatomical morphology of the eye. There is a system we call the canal of clem, through which the aqueous humor in the eye flows out and all that to maintain a certain level of intraocular pressure within the eye. Trauma can actually cause that canal of clem to close up and all that, and of course glaucoma can come up to be. So we try as much as we can to avoid such physical altercation and all that. Of course, lifestyle, there are certain things we can congest, we take and all that can actually lead to glaucoma. For instance, excessive intake of alcohol.
Excessive intake of alcohol.
Exactly, can actually lead to your eye pressure. Your eye pressure.
If you're in that club, exactly, you need to stop.
Yes, because in research, in fact, there was a forensic research that was carried out some years back, and 6 months after the death of the person, within the optic nerve vessel and all that, it was discovered that there was excessive alcoholic, toxicity on the nerves and all that, and obviously the nerves were actually, damaged and all that. So these things are things that can actually cause glaucoma to be in place.
So the optometrist and dispensing optician Regional Board of Nigeria, why is it silent about this?
Okay, well, I wouldn't say we're entirely silent about this.
Because, like you said, speak and correct it. We are not saying surgery, and the surgery should be free. You understand? Screening, as we're in glaucoma week, we're not seeing the screening.
Okay.
So how can people now?
No, first and foremost,
be sure that their sight to be protected.
Okay. First and foremost, the Optometrists and Dispensing Opticians Registration Board of Nigeria, an agency and arm of the federal government under the Federal Ministry of Health, being led by the Registrar and Chief Executive Officer, Dr. Edwin Awiaka, is an agency that's saddled with the responsibility of regulation. It's a regulatory body, primarily by its acts that established it and all that. In the body, in the board, aside this regulation, recently the Chief Executive Officer had come up with a vision on the area of blindness intervention program, aside what we're doing as regulation or a regulatory body and all that, which kickstarted sometime last year with the novel or median edition of Run to End Blindness Awareness campaign. It happened sometime in October during the Warside Day program, where the special advisor to the President on Health, Dr. Sama Anas, flagged off that program, and it was a beginning of one of those intervention programs we want to do to help curb the prevention or prevalence of blindness in Nigeria, as the case might be.
If OD or RBN is saying 1 out of every 20 Nigerian has glaucoma, and of that figure, 1 out of every 5 of them will be blind, we're talking about over 60 million Nigerians have glaucoma. So we need to protect their sight.
Absolutely. And that is exactly what we do in this period. With our blindness intervention program and this sensitization we're talking about now, and also the free vision screening which the board on its own decided to do. Now, outside the board, we also have a body, okay, that is the Nigerian Optometric Association, where you have practitioners as members. In the various states, they are carrying out a lot of sensitization awareness this period, and also carrying out a lot of free vision screening exercise in order to detect the members of the public who have glaucoma, okay, and then refer them to the right facility for follow-up, as the case might be.
And also to inform their family that
of course that
in the blood.
Exactly. So across the nation, this thing is happening as we speak. There are free vision screening going on and all that. Even in the agency, the board itself, in all our zonal offices, as at yesterday, we had free vision screening exercise in all the zonal offices in order to identify patients who have this condition and then refer them to the right. So
if you now identify, do you have the required personnel to treat?
Exactly, just as I said, when you identify, you now refer to the right facility.
Do we have them?
Yes, we do.
This in the country.
Very well. Yes, I understand. The Jama syndrome. Actually, yes, it's a very important area of concern. To tell you the truth, the health sector in Nigeria is actually in crisis of human personnel because of the mass migration of some of these health professionals and all that. However, the little that we still have staying back.
It's actually little.
Yes, because the manpower is not enough. It's not enough to cater for the yearning population we have in the country, and not to talk of people who have this kind of conditions and all that. And that is why we consistently also appeal to the federal government to keep creating room or opportunity to engage more optometrists in the public sector, in the teaching hospitals, in the federal medical centers, in the state general hospitals, are you getting me, to be able to cater for this yearning population that have this kind of conditions, to manage, to diagnose, and where there is need to refer to a higher, consultancy and all that, they can be able to make such a reference. And not just only creating that opportunity, also to enhance the take-home of these professionals, because these are the things that encourage them.
When it comes to take home, even the tomatoes want an increase.
Absolutely.
It's an issue.
It's a general issue.
Everybody wants increase.
But we believe.
But I think, how many do we have? How many optometrists do we have in this country?
Well, at the moment we have a little above 6,000 optometrists registered with the Optometrists and Dispensing Opticians Registration Board of Nigeria. Now, out of the 6,000, of course, there are some who have left the country, There are some who may have decided to carve a niche in another, line or area or endeavor and all that. And then the remaining, of course, you know that the number is still not adequate to cater for over 200 million Nigerians, as the case might be. So that is where we are at the moment. However, the Honorable Minister for Health states, and he has given a mandate some time ago to have increased number of training institutions offering this profession, and also to increase the quota of admission for those who are already offering this profession, in order to meet up, at least, close a little the gap of, deficiency between optometrists to the number of patients.
All right, I must thank you for your time during the program this morning. Time is usually our friend here. The discussion has been with the essay to the Registrar of Optometrists and Dispensing Optician Regional Board of Nigeria, Dr. Chinaka Nwosu. Thank you for your time.
Thank you so much.
And this is where we wrap up. I'm sure you've taken note of what you must do to prevent glaucoma. It's a thief, as it's described, because you don't know when it's coming, you don't know when it's there, it has no sign and symptom. All you need to do is to avail yourself for screening at least once in a year. That way, it can be detected, and of course, it can be managed. This is where I say thank you for your time. I'll see you again. I'm Joseph Kadri.